Hello, this is Dr. Liles' office. Dr. Liles speaking. Oh, hi, Miss Lee. How are you? Oh, no, I'm very upset to hear that your horse is not well. You said he's not eating and is not feeling well? Well, that is extremely concerning. Okay, well, you just keep a good eye on him and I'll be right over.
Oh, thank God you're here, Dr. Liles. My horse Storm has been feeling horrible.
Oh, can you give me some information about Storm, like his breed, age, and gender, so I can update his online patient chart here?
Storm is a is a gelding Morgan Cross. He's about 14'2", and usually he's quite robust and healthy. He's only like 14 years old.
Now, what symptoms is your horse having today, Ms. Lee?
The last couple days he's really been off his feed, and I thought it might be because of the feed, because it's gotten really warm lately. So I thought maybe the grain had just gotten some mold in it. I opened a new bag today and he was still really picky and didn't want to eat at all. And then he was really lackluster this morning. Like, he barely moved when I came in. Usually he's throwing his head over the side of the stall whinnying. And then he had a fever of 102.
It was an extremely high fever.
Extremely for him. He usually runs really low on all his previous vet visits.
So have you given him anything for the fever?
No, I was going to give him Bute, but then I found these weird lumps on his neck, and I don't want to give him something if I don't know what these lumps are.
Well, let me check these lumps out. Well, these lumps, they're right around the head and neck area. As you can see, they're right up under the jaw. And because of the placement, I'm going to take a guess here and say that they are swollen lymph nodes. Now, your horse right now is also panting very heavily and is having a thick nasal discharge. Is that normal, or has that been occurring recently?
No, that's new today. He hadn't had that the last few days.
With all these swollen lymph nodes, the panting, the unwillingness to eat, the thick yellow discharge, I'm going to guess that your horse has strangles.
Oh, no. Where could he have gotten it from?
If you've taken him to any shows lately, or even just off the farm, he could have gotten it there, because Strangles has a 3 to 14 day incubation period. So it would have taken that long for your horse to develop any symptoms like these. Our problem, however, is that it is very contagious. So we'll have to work on isolation as soon as possible.
So we're going to have to isolate the other horses? Oh man, Casey's show season just started, and is it airborne? Is it going to transmit it by air?
No, it is not airborne, luckily. Thank goodness it is only transferable from contact between horses. So we do need to keep all the horses here that could have been exposed. But if we just isolate your horse and keep all the other horses, keep a good watch on them, and don't let them leave the farm, and don't let any other new horses onto the farm, then hopefully we can keep this disease from spreading any further.
Well, that's a relief. But how long are they going to have to be here? I mean, it's the summer. This is the season everybody goes out and travels.
I know. Sadly enough, these outbreaks can last a fairly long time, up to several months. But humans cannot catch strangles, luckily. So, however, you do need to be very careful, because they can pass the infected strangles from horse to horse. So you would definitely want to be careful and wash your hands very diligently and clean up and keep the barn very well sanitized after your horse to prevent its spread to anyone else. But since we've caught it nice and early, there's a very good chance that your horse will survive, as Strangles does only have a 1% morbidity rate, unless it's bastard Strangles, where the morbidity rate does increase drastically.
Well, thank God it's not bastard Strangles then. But what is Strangles? I mean, that's a really morbid name for a disease.
Strangles is the name that we call a disease caused by the bacteria Streptococcus equi. It is where this bacteria gets into your horse's respiratory tract and does cause extremely swollen lymph nodes, and these lymph nodes will abscess in the neck and head area. And when these lymph nodes swell and get very hard before they burst, it can cause strangulation or constriction of the airway, which is why it's called Strangles. However, in today's day and age, where we have all of these treatments and options to help the horses out, this strangulation is not as common as it used to be.
Oh my God. Can you pop the abscesses? I mean, I really don't want my horse to choke. He's my best friend.
I will lance the abscesses. However, right now, my main reason for doing that is to ensure that my diagnosis is correct. I will take the pus from these abscesses or from his nose to test it with a simple sugar test to ensure my diagnosis so we can go on further with his treatment.
So the isolation of the other horses was mostly a preventative measure to keep them from getting it?
Yes, it was. And now I will gather this pus and I will have it cultured as soon as possible.
Okay. Thank you, Dr. Liles. Oh, thank God you're back, Dr. Liles. What were the results?
So my on-site diagnosis was correct. Your horse does have Streptococcus equi bacteria or Strangles.
Oh, it's a good thing we moved the other horses then. Poor Storm.
Well, it's a good thing that none of the other horses have been showing signs yet. So hopefully they did not contract the Strangles before we got them isolated. So it is a very good thing that we did catch this early. Because if we had not, we could have treated it incorrectly and caused some immunity issues and caused bastard strangles. Bastard strangles is when lymph nodes other than the ones in the neck, like your horse, have been infected. So this would be when the lymph nodes in the abdomen or lungs have been infected. And it is an extremely hard to treat disease and can definitely cause death in horses.
Oh, God.
However, we did catch it early enough that we will be able to treat it with penicillin G, which I have with me today. And hopefully we can get your horse back on track.
Oh, thank you, Doctor. How could I have prevented this? I mean, I don't hear every day about outbreaks of Strangles, but the way you said it, it's really infectious and could have caused major outbreaks the last couple of years.
Yes, it definitely could have. If your horse was in a later stage, we would have definitely had to lance the abscesses and put him in more of a nursing care program instead of providing him with the antibiotics. And then we would have lanced the abscesses and kept them clean with an iodine-based solution after. The disease is extremely contagious, so that is why we have developed a vaccine for it. This vaccine, it can be provided intranasally or intramuscularly, and it is provided in a modified live or a killed version for all different variable types of horse owners.
But I did give him a vaccine for it. I remember very clearly he got a vaccine for Strangles about 2 years ago.
Well, Miss Lee, the vaccine is a yearly vaccine. This is why your horse has Strangles. That is probably my fault because I definitely should have told you that. I do not know why I would have forgotten it. But as an educated horse owner, let's continue on in our education here. That Strangles is a yearly vaccine and that it is a very important step in preventing disease outbreaks. How, along with this, is hand washing and barn cleaning, which can also help prevent future disease outbreaks as well.
Okay. Thank you, Dr. Liles.
Yes, I will be back in 2 weeks for a follow-up consult.
Can I have the antibiotics?
You can have the antibiotics. Thank you.
Thank you.